Hello everyone. First, let me introduce myself. My name is Yakovleva Alena and I am the student of Tver State Medical University. Today I'd like to talk to you about pharmacogenomics. My objectives today are to review challenges of the one-size-fits-all approach in healthcare, to define pharmacogenomics and its role in personalized medicine, to discuss the advantages of the pharmacogenomics, to describe the use of pharmacogenomic testing in healthcare, to outline technologies for pharmacogenomic testing, to discuss challenges of pharmacogenomics, and to highlight emerging trends in pharmacogenomics. Let me begin by explaining challenges of the one-size-fits-all approach in healthcare. The one-size-fits-all approach to drug delivery faces numerous challenges in healthcare. Individual variability in genetics, metabolism, and health conditions means that what works for one person may not work for another. Adverse reactions and suboptimal efficacy can occur when medications are administered uniformly. Moreover, the risk of drug resistance increases, particularly with infections and complex health conditions like cancer. Comorbidities further complicate treatment, as does patient adherence and preferences. Health inequities can exacerbate these challenges, impacting diverse populations differently. Cost effectiveness is also a concern, as standardized treatments may not always be the most efficient use of resources. These limitations highlight the importance of personalized medicine approaches that account for individual differences and optimize treatment outcomes. Pharmacogenomics, at the intersection of pharmacology and genomics, revolutionizes drug therapy by tailoring treatments to individual genetic profiles. This field explores how genetic variations influence an individual's response to drugs, aiming for safer and more effective medication outcomes. By understanding how genes impact drug metabolism, efficacy, and toxicity, pharmacogenomics enables personalized medicine, enhancing patient care and minimizing adverse reactions. Through genome-wide association studies and sequencing technologies, researchers identify genetic markers associated with drug responses, paving the way for targeted therapies. To put it more simply, pharmacogenomics is like a map that shows how our genes affect the way we respond to medicines, or how tiny differences in our genes can make a big difference in how our bodies react to drugs. It helps doctors choose the right treatment for each person based on their genes. This can make treatments safer and work better for everyone. Pharmacogenomics plays a vital role in oncology, optimizing chemotherapy regimens based on tumor genetics to maximize efficacy and minimize side effects. It also informs psychiatric treatment, guiding medication selection and dosage for conditions like depression and schizophrenia. In cardiology, pharmacogenomics informs the use of anticoagulants and antiplatelet agents, reducing the risk of cardiovascular events. Additionally, pharmacogenomic testing is increasingly integrated into clinical practice, empowering healthcare providers to make informed decisions. Pharmacogenomics relies on advanced technologies to explore the relationship between genes and drug responses. Genome sequencing allows for the comprehensive analysis of an individual's genetic makeup, identifying variations that may impact drug metabolism and efficacy. Microarray analysis simultaneously examines the expression of thousands of genes, revealing patterns associated with drug responses. Next-generation sequencing enables rapid and cost-effective sequencing of DNA, RNA, or entire genomes, facilitating large-scale studies to uncover genetic markers relevant to drug responses. Polymerase chain reaction amplifies specific DNA sequences, aiding in the detection of genetic variations related to drug metabolism enzymes or drug targets. Mass spectrometry analyzes the structure and quantity of proteins and metabolites, providing insights into drug metabolism and pharmacokinetics. Bioinformatics tools are crucial for analyzing large-scale genomic data, identifying genetic variations, and predicting drug responses based on genetic profiles. High-throughput screening techniques rapidly test large libraries of compounds to identify potential drug candidates and understand their interactions with specific genetic variants. CRISPR-Cas9 gene editing enables precise modification of the genome, allowing researchers to create cellular models with specific genetic variants for studying drug responses. Pharmacogenomic databases compile genetic and clinical data, providing valuable resources for identifying genetic variants associated with drug responses and informing personalized medicine approaches. As more healthcare providers embrace genetic testing, pharmacogenomics is gradually becoming a standard tool in medical practice. However, there are challenges to overcome, such as interpreting complex genetic data and ensuring equitable access to testing for all patients. Moreover, ethical considerations regarding patient privacy and potential discrimination must be carefully addressed. Despite these challenges, the potential of pharmacogenomics to revolutionize healthcare is immense. With ongoing advancements in technology and increased awareness among healthcare professionals and the public, pharmacogenomics promises to usher in an era of truly personalized medicine. By harnessing the power of genetics, we can optimize treatments, minimize adverse effects, and ultimately improve health outcomes for individuals around the world. Thanks for your attention.